Hello everyone, welcome back to my YouTube channel Speedy Dentistry. Today we'll be learning about pleomorphic adenoma. So pleo or pleos basically stands for many and morphic stands for form. So this adenoma will be seen in various forms, and adenoma is basically affecting the glandular structure. So Willis first described it as an unusual histologic pattern of the lesion. Coming to the clinical features, it is the most common affecting superficial lobe of parotid. So you can remember it as parotid pleomorphic. So pleomorphic adenoma will be most commonly seen in parotid. And this swelling is firm, slowly growing, and asymptomatic. So it will be asymptomatic, which is smooth, rounded or lobular, and is mobile with rubbery consistency. No need to worry, we'll learn this through a picture. Rubbery consistency, and this swelling will lead to ear lobe elevation. And this will be seen more commonly in females of approximately 40 to 50 years. And this swelling will be encapsulated. So it will be encapsulated. Since it is encapsulated, it won't show any fixity to deeper tissue. So remember this via this female of approximately 40 to 50 years of age, and as you can see, she is holding dumbbells. So when both superficial and deep lobe of parotid are affected, dumbbell swelling is seen. Also, building muscles through gymming is a slow process, and firm muscles are developed. So firm, slow growing, and she won't develop any diseases further. So the swelling will be asymptomatic. Also, this process is smooth, and she's having round or lobulated face, and she is able to move. So mobile with rubbery consistency. Her hair are ties signifying rubbery consistency. Also, the earrings or ear lobules elevation is seen. Now coming to the other structures affected, since most common is parotid, others will also be affected. When it is in minor salivary gland, when minor salivary gland is affected, mainly at the palate, it may appear fixed to the palatal bone, and once it has been fixed, it can invade or erode the bone. Also, since it is a tumor, mucus accumulation can be seen inside it. And when it is seen in submandibular gland, once it is seen in submandibular gland, bimanual palpation is done, and fine needle aspiration cytology can be performed to form the diagnosis of pleomorphic adenoma. Now coming to the histopathological examination, it was given by Foot and Frazal. So they classified it into 4 types. Just remember M is equals to C is more, and C is very high. So this one is principally myxoid. First category will be principally myxoid. In second, it will be equally myxoid and cellular Third one is predominantly cellular, and fourth one stands for extremely cellular. So the contents will be extremely cellular for fourth category. Coming to the management part. So what used to be done for this is surgical excision. Surgical excision, but historically for pleomorphic adenoma, enucleation was performed. And surgical excision is treatment of choice nowadays. Also, most widely accepted is superficial parotidectomy. This is defined in my previous videos, what is superficial parotidectomy. And we have seen in this superficial lobe is affected most commonly. So we'll remove the superficial lobe, or if both the lobes are affected and causing the dumbbell swelling, in that case we'll be removing the total gland, that is total gland excision along with facial nerve preservation if this nerve is not involved. Also, we have seen other than pleomorphic adenoma affecting the parotid gland, it can affect the submandibular gland. So for the submandibular gland, we'll excise the gland, and when it is affecting the minor glands at palate, we'll remove the tumor along with periosteum. Since we have seen it can even invade or erode, in that cases we'll perform partial maxillectomy or total maxillectomy. So to conclude what we have studied till now, that pleomorphic adenoma is a tumor which is seen in many forms in adenoma affecting the glandular structure. So it will be a salivary gland tumor, and 40 to 50-year female will be affected most commonly, and firm slow growing swelling elevating the ear lobule will be seen, and dumbbell shaped swelling will be seen when the tumor is affecting both the superficial and deep lobe. Then we studied the histopathological examination, which was given by Foot and Frazal, and they classified it into 4 classes. And then the management part, in which surgical excision is treatment of choice nowadays. Also, we've seen that historically enucleation was performed. Most widely accepted as superficial parotidectomy or total gland with facial nerve preservation. For the submandibular gland removal is done. And for palate, tumor removal along with periosteum is performed. And in cases where partial maxillectomy or total maxillectomy is required is when the tumor has invaded or eroded the bone. Thank you for patient listening. Stay tuned for more.